Welcome back. You can still call in while we continue with the questions on pneumonia. In all of this, are there any people who actually fight off the infection? Pneumonia has set in, but they get better without treatment, with no intervention.
The majority of children who develop pneumonia would actually fight off the infection with absolutely no need for treatment. As I said, pneumonia is primarily the most common organism responsible for causing pneumonia is actually viruses, and viruses will just run their course, and the immune system of healthy children will deal with whatever insults, whatever missiles the viruses would throw at them. And so most children actually who develop pneumonia would actually have the pneumonia resolved without any form of intervention. However, we still advise that if the child develops any symptoms that worry you, you must bring the child to the hospital as soon as possible.
Okay, we have a tweet from Gloria, and she's saying, my baby is 3K old. Could that be 3 months or 3 years old? And his cord hasn't fallen. Also, he doesn't have the usual BCG scar. Should I be worried? But before you take that, let's take this phone call. Hello, David.
Yes, good afternoon.
Good afternoon.
I've had pneumonia for about 15 years now. And I kind of like, yes, even presently right now. Okay. I think is there a particular drug one can take, because I've had several culture sensitivity tests.
Okay, thank you. We can't talk about drugs on the program, but I'm sure the doctor will enlighten you.
I didn't get the name of the caller.
I
didn't get the name of the caller.
I didn't get her name.
All right. Okay, caller.
Okay, it's a man, and he's David.
David, pneumonia for 15 years, that's quite a long time to have a lung infection.
And that happens? 15 long years, one person?
Well, it's a possibility, especially if it's specific conditions. So, for instance, tuberculosis in our environment is the commonest cause of chronic lung disease, chronic pneumonias. However, it would be interesting to know, what has been done so far. But what I would suggest is that he actually goes to a hospital where there are specialists who deal in treatments of tuberculosis, because that's my first hunch. That's the first thing I think about. But there are other possible causes of reasons why he could cough. It might not really be a pneumonia. It might just be something that might mimic a pneumonia, but it really might not be a pneumonia, because things like asthma can give you cough for a very long time. You might just imagine that it's a pneumonia. Things like emphysema, things like chronic bronchitis, people who smoke. So a history, asking him questions about what could predispose him to chronic cough, I think that's the first step to take.
Okay. So how about Gloria's baby with the lack of the BCG scar and the cord that hasn't
It's
fallen?
interesting. I hope after 3 years, I hope that's 3 months, because even after
even if it's 3 months,
even if it's 3 weeks, even if it's 3 weeks, that's a long time for the cord to still be there. For the cord to still be present at anything after 2 weeks, really, that really is a prolonged. The cord really should fall after
that's
about 10 days.
A hospital visit.
That's a hospital visit, definitely a hospital visit. And as for the BCG scar, it's a specialized thing. The fact that the BCG scar isn't there doesn't mean that the child was not immunized. However, we go ahead and still, if she's particularly concerned or worried, we still go ahead and do certain tests, to confirm if the child is susceptible to developing tuberculosis, which is what BCG should protect the child against.
All right, this is Monier with a tweet asking you for early signs of pneumonia in children, but I believe you've treated that. Those signs you gave us, are they early signs? Indrawn chest, coughing, temperature?
Early signs would be things like fever and fast breathing. So fast breathing. So I think fast breathing is what you should look out for. By the time the child starts the chest indrawing, things have gotten a little bit critical. So fast breathing is probably where you should start with if you wanted to, determine if the child has pneumonia. But usually a pneumonia would develop from an upper respiratory tract infection. So for instance, there might be catarrh, there might be a little bit of coughing. And so if you notice that the child is having catarrh and coughing and suddenly develops some difficulty with breathing or some fast breathing, then a pneumonia has probably set in.
Okay, so this will be my final question. Is pneumonia completely curable?
I have good news for you, Mary, that pneumonias are completely curable. As a matter of fact, unlike horrible things like meningitis, pneumonias rarely give you long-term problems and long-term sequelae. So pneumonias are curable. So it really is a pity that many children are dying for a condition that is extremely preventable and extremely curable.
Thank Thank you so much, Dr. Rena. This has been very enjoyable.
Thank you very much.
Thank you for staying with us on the show. All of you who called, wonderful questions. Have a lovely day. I am Mary Alale Yusuf.